Sometimes a patient can be injured while they're receiving care from a registered health professional. Adverse outcomes can happen as a normal part of providing treatment, but sometimes things might not go as expected. In these cases, we may be able to provide cover for patients for a personal injury caused by treatment. Here's what you need to know about treatment injury cover. You should consider lodging a treatment injury claim with us if the patient's injury isn't a necessary part or ordinary consequence of the treatment. Once we receive a claim, there are some things we consider before making a decision about cover. The first thing we need to know is whether treatment has been provided by, or at the direction of, a registered health professional. Our legislation gives us a very broad definition of what constitutes treatment, and this includes where there has been a failure to provide treatment. We also need to see that there's evidence of an injury which has resulted in bodily harm or damage to the patient. This could be something like a severed nerve, which is causing pain or numbness. Under our legislation, symptoms without an identifiable physical injury are not coverable. The patient's injury must also have been caused by a treatment, not an underlying condition. Sometimes that may not be immediately clear, but we'll consider the evidence and decide causation on the balance of probability. In other words, whether it is more likely than not that treatment has caused the injury. There are some situations which aren't coverable under our legislation. The main reason is if the injury is a necessary part or ordinary consequence of treatment. For example, if a surgeon needs to make an incision of the abdomen, we know this will cause direct damage to the skin and underlying structures. This is a necessary part of treatment. Sometimes an incisional hernia develops at the treatment site. At stoma sites, for example, this is very common and not unexpected. This would be considered an ordinary consequence of the treatment. The courts have provided guidance on how to consider whether an injury is an ordinary consequence. This must take into account the clinical knowledge at the time of treatment and the underlying health condition of the patient. Because everyone and every situation is unique, we consider treatment injury claims on a case-by-case basis. That means while a claim may be accepted for one patient, it may not be for another. And that's the basics of treatment injury. If you want to know more, take a look at the Treatment Injury Claim Lodgement Guide on our website. Thanks for watching.